Good evening, everyone, and welcome to another webinar hosted by the Royal Australasian College of Surgeons. These webinars are to update trainees and specialist IMGs on the pathway to fellowship in regard to training issues, examinations, assessments, etc. On behalf of the Royal Australasian College of Surgeons, I would like to acknowledge the traditional owners of the lands that we are meeting from, or where we are today across Australia, and to extend my respects to their elders past, present and emerging. And tēnā koutou, tēnā koutou, tēnā koutou katoa for those who are dialing in from New Zealand. So welcome everyone. My name's Adrian Anthony. I'm a general surgeon based in Adelaide. I'm a college counsellor and I chair the Board of Surgical Education and Training. So that's the board where all the specialties convene to discuss training matters. I have with me a number of my colleagues tonight on panel. I have Associate Professor Julie Mundy. Julie is the Vice President of the college. She's a member of council and is a cardiothoracic surgeon based in Queensland. So welcome, Julie. I also have Professor Chris Pyke. Chris is chair of the Court of Examiners and a member of council. Chris is a general surgeon also based in Brisbane. So welcome, Chris. I have Professor Kerin Fielding. Kerin is Deputy Chair of the Board of Surgical Education and Training and also Chair of the Specialist International Medical Graduate Committee. Kerin is a council member and she's an orthopaedic surgeon based in Wagga Wagga in New South Wales. So, welcome, Kerin. And the youngest and brightest on our panel tonight is Dr. James Churchill. James is the chair of the College Trainees Association and a final year trainee in urology. He's based in St. George, Sydney. So welcome to you, James. Also in the background, who you won't be seeing tonight, but important in coordinating questions and running the show, we have Grace Chan. She's the Academy Program Coordinator in the Professional Development team at the college, and Professor Julian Archer, who's the Executive General Manager of Education for the college. And Julian will be moderating the online questions. And on that note, I would certainly encourage all of you to submit any questions, and we will certainly try to answer them to the best of our ability. So panelists, thank you very much for your time tonight. The format of these webinars in the past have been identifying a number of themes that have been drawn from questions pre-submitted by the attendees. And for tonight's meeting, we have two key themes. Not surprisingly, the first one is on the fellowship exam, and the second one is around training and also progression within training, around in-training assessments. So for those of you listening in tonight, you can use your question pane to submit your questions. And as I said, we will certainly make every effort to answer them to the best of our abilities. And before we start on the submitted questions, I would like just to emphasize that the college is well aware of the anxiety and the stress that the COVID has caused in terms of disrupting our professional and personal lives and the impact that that has on exam preparation and also in performance during your clinical term. So we are well aware and very cognizant of that, and we are trying to do everything that we can, which is reasonable to do, to try to offset some of the disruption that has occurred. Okay, so we'll start with the first key theme, which is on the fellowship exam. And I thought before we start the questions, I might ask Chris Pyke just to give us a brief update or comment on how the written exams went a couple of weeks ago. Over to you, Chris.
Thanks, Adrian. I think almost all of you on this evening's webinar will have completed the writtens. The written exams were provided for 290 candidates. on the the second week in September. They seem to have gone without a hitch. There were a number of special considerations which needed to be taken into account, but I have to say overall the problems with the writtens didn't seem to eventuate. So it was in multiple centres, as it always is. There were some rural centres that were being tried out for the first time, and our overall impression is that from the college's point of view, that they seem to have logistically run just fine.
Thank you, Chris. So our first question is really about the plans for conducting the viva component of the exams in a few weeks. So what are the plans for the fellowship exam? And I know that's a pretty broad question, but I guess it's about the format of both the clinicals and the vivas. Julie, would you like to give us an outline of what the various specialties are planning?
Okay, so the clinical viva and viva exams are going to be held over 2 different weekends. So there will be orthopaedics and general surgery on the 10th and 11th in Auckland. And then the following weekend on the Friday, Saturday, Sunday, so 16th, 17th, 18th of October, there will be all of the other specialties, including general surgery and orthopaedics in Australia. And those exams will be conducted concurrently in Auckland, Brisbane, Sydney, Melbourne, Adelaide and Perth. So some specialties will be in most of those venues or all of those venues, and some specialties will only be in some of them. But they will be held concurrently, which means that some candidates might find themselves being quarantined for a little bit longer at the beginning and at the end of their viva examination. And that's really to minimise the risk of dissemination of exam content between locations. So obviously the logistics are quite difficult because there is a 5-hour time difference between Auckland and Perth when daylight saving is enacted at the beginning of October. And also some locations might only have cycles of 2 candidates and other locations might have cycles of 4 candidates per examining pair. So obviously to marry all those things up might require some slightly longer quarantine times than what candidates would normally be expecting. The candidates will all be in the room with at least one examiner, but there may be a second zoomed in examiner, or there may be an additional observer in the room, or there may be a zoomed in observer. And this is a bit different for all the different specialties, but all of the exam candidates will have received the information, the notes to exam candidates from their relevant specialty senior examiner, and that is the point of truth for their particular exam. So they need to make sure that they read that, because that's how their exam will be conducted. So it might be a little bit different between urology and orthopaedics or cardiothoracic and vascular, but their specialty will have let them know exactly how it is going to be for their specialty.
Right. And Julie, are there any of these specialties holding any part of the vivas as a virtual component?
I'm not quite sure what you mean by virtual.
Yeah, as in via Zoom or Teams or one of those platforms. I know that you're saying that examiners may be in attendance virtually, but will candidates actually be examined via a virtual platform?
No, the candidates will be sitting in a room face to face with at least one examiner, and in many situations 2 examiners.
Right, yeah. And Chris, I know we covered off on this on a previous webinar on the exam, but in terms of COVID safe practices, can you reassure everyone that every step is being taken to ensure that the exam complies with the required COVID safe practices?
Yes, every venue has a COVID safe plan and has approval from the relevant local authority, like health department. mainly due to the efforts of Julie, we now have travel plans for those from rural areas to visit Sydney and to return. And we also have permission for those in Melbourne to attend exams at hospitals in Melbourne without any other restriction. The actual COVID safe plans usually will involve some screening at the venue, be it temperature taking or questions about travel or contact with COVID patients. And if the prevailing conditions at the time are that masks or some form of PPE be worn, then that will also be what will happen during the viva as well.
Yeah. And is that information part of the notes to candidates that there is a possibility that they may need to wear masks and etc.?
It's part of the letter that the candidates will receive either today or tomorrow. That's covered in that letter.
Thank you. Yeah. And in terms of regionally based candidates who have to attend an exam centre, are there any restrictions on them attending from a government point of view or jurisdictional point of view?
There's no restrictions in New Zealand at the moment for people attending Auckland, and we fully expect Auckland restrictions to become even less over the next few weeks. Queensland has no restrictions on regional people attending Brisbane, same for Western Australia, same for South Australia. The two states that have had restrictions, and not just totally by border type closures, but by health departments, have been Victoria and New South Wales. But we written to the Chief Health Officer in Victoria, Brett Sutton, and we have approval for regional candidates to attend Melbourne and for Melbourne candidates. And the latest letter that Dr. Pyke and I have sent you will also suggest that you carry the information that the college will be sending you about the exam with you, so that if Melbourne is still in lockdown, you've got that. You also probably need to carry your hospital ID on you when you attend the exam, just so that in travelling to the exam, if you were stopped, you've got your hospital ID and the fact that you're attending the exam. But the Chief Health Officer in Victoria has given approval for all Victorian candidates to attend. The same thing goes for New South Wales. Brad Hazzard, the Health Minister, has given approval and has said that there is no limitation on regional New South Wales surgical trainees from attending Sydney for the exams and then returning back to their regional centre without any need for any form of quarantining. Now, of course, that could change in 2 or 3 weeks' time if suddenly there was an outbreak, but at this point in time, and it's fair to say that everything has been looking better and better in every region, so at this point in time, things look very favourable that things may even be better than they are now, but we have approval basically for everyone to attend the exam. Having said that, the candidates from Western Australia and Tasmania who need to travel to South Australia will need to get re-entry permits before they leave their states, and they will need to isolate on return to Western Australia and Tasmania. And despite our attempts at negotiating otherwise, those two states have really been quite adamant about that. But I do go into that in some detail in the latest letter that you will get from us with your sort of fortnightly update. So it involves 2 candidates in Tasmania and 11 candidates in Western Australia.
Thank you, Julie. Chris, how and when will candidates be informed of their results after the vivas?
So the Australian exam, if I could address that first, the results will not come out until Friday, the 23rd of October. And that will be at around the middle of the day, Melbourne time, on the 23rd of October, done by SMS. My understanding is the New Zealand exam on the first weekend will have a more more rapid turnaround on the results in the more traditional manner.
Yeah. Okay, and in terms of a candidate who has sat the written exams, who then gets unwell or has to quarantine and is unable to front up for the vivas, what will actually happen to their written exam results and what happens to their exam sitting?
So for this year, there is the capacity to carry over the written exams until the next sitting of the vivas, which we would have planned at this stage in May 2021. So if they've completed the writtens but can't sit the vivas, there would be a plan to allow them to proceed directly to the vivas at the next sitting of the fellowship exam.
So you're saying that, right? Does that relate to any particular illness, or does it have to be a COVID-related event?
I think at this stage we would be applying that to everybody for this particular fellowship exam.
Right. Okay. Okay, then. So we might move on, James, to asking you about RACSTAR's perception about the communication from the college regarding the fellowship exam preparations, etc. So how has RACSTAR actually viewed the quality and the mode of communication to candidates?
Thanks very much, Adrian. I mean, it's the short answer is that we're happy with what's been happening, and I'll go into that in a bit more detail. The difficulty with this year, obviously, is that there are so many moving parts in what's happening to organise this exam, and as has been illustrated, running and organising exams in just about every capital for 9 different specialties, in some cases, means a very large number of simultaneous venues. And each of those then have their things that change sometimes on a weekly basis. So it's a moving feast of what can be communicated at different times. And the principle has been all along that we've been supporting a stepwise process of moving in the right direction and in the same direction in terms of what the contingencies are that are being narrowed down, but not communicating unlikely contingencies, and getting that balance right is very difficult. We're aware that some trainees and certainly at some points, RACSTAR have been keen for the college to be more forthcoming on what those contingencies are, but overall we've certainly been very impressed with the fortnightly bulletins that are currently existing, and that's being reflected in the number of questions and the number of comments and feedback points that are coming through to us at the moment. So overall, very appreciative of the involvement by the higher levels of the college that have convened, for example, the exams committee working group, or the exams working group that meets on a fortnightly basis. And we've appreciated involvement directly in that group. And certainly the thoughts and questions and feedback that have been collected by RACSTAR have been fed directly into that group to then influence the specifics of what goes forward with organising the exams. So the short answer is happy in a difficult situation and acknowledging that it's impossible practically for the college to keep everyone happy at all times, but managing well in the circumstances.
Thank you, James. I'm certainly aware that the college is understanding that different people have different expectations about the type of information and when it should be conveyed, and even the amount of information, but I think the college has really tried to ensure that there's a very considered approach to communication. You mentioned about receiving the communication or questions, if you like, inquiries from candidates and trainees. Do you mean like you've been receiving less questions, or you've been receiving more questions?
I think it's fair to say that as the year has progressed and as the picture of how, I mean, the example of the fellowship exam is probably the easiest scenario to paint. I mean, as that exam has drawn closer and as it's become more clear exactly what restrictions are in place for it, and therefore what adaptations the college has to put in place to run that exam, we've been the frequency of concerns and complaints, I suppose, I think it's fair to say, has been decreasing. Now that may also reflect that it's getting pretty, the sort of the chronic stress of a COVID environment in some states certainly means that might mean that there's less commentary coming through. But our interpretation of that is that the goal is now in sight, and the understanding is greater as to exactly what that goal of running a successful fellowship exam in the circumstances is. So I think it's fair that the way that the college is currently approaching communication with trainees via these regular updates, via these webinars that allow for people to put in, completely unfettered questions to a panel of people who are the experts in their particular area within the college, has been appreciated.
Yep, and I would certainly encourage all trainees and SIMGs to not hesitate in coming forward with questions to the college.
Yeah, this environment is really the perfect one to ask the questions that you've got.
Yep. Chris, James actually mentioned about stress and chronic stress, and I said up front that the college is well aware that the COVID-19 disruption has been quite stressful for many of us. So stress from that disruption may adversely affect candidates' exam performance. Will this be accounted for when assessing candidate performance during the vivas?
I think if the mechanisms which are in place would be normally the special consideration forms which affect the performance of the exam at the time. I have to say the general stress in the community regarding COVID and the pandemic, we would try to, we'd encourage the candidates to notify the training boards of that early so that they can get help from Converge if necessary. I think other than it affecting the actual performance of the vivas on the day, our expectation is that everyone will be similarly affected by the pandemic. We're not unsympathetic to the idea that there is a contingency for candidates if they feel like their preparation has been completely affected by it, that they can withdraw without financial penalty up to the day of the vivas. There will be a second process around whether that constitutes a suitable withdrawal to allow them to carry the writtens, as it were.
Right. Yeah, and will special consideration be given for candidates who claim that they've had undue stress experienced during an exam as it relates to COVID and all the disruptions around that?
So as with all special considerations, we would take that, they'd have to fill out the form. It would have to be, the mark that they achieve would have to be in the band where we would normally look at special consideration. That is, if they've already passed, we don't look at it. If they've already scored a mark which is a clear fail, then it's not looked at. And if they're in a discussion band, that is where they appear to have passed everything but one or perhaps two of the vivas, then in that circumstance, if it looked like that they may not pass, then special consideration would be taken into account then.
Right. Thank you, Chris. James, I'd like to go back to you and maybe ask you to refer back to your own personal experiences, but how can candidates minimise the impact of stress on exam performance? And whilst that's a pretty generic question or general question that can apply to any exam sitting, I guess I'm also talking about the context of COVID and all the requirements around them.
Yeah, thanks very much, Adrian. So it's obviously going to be strategies that work for individuals, and there's no one answer as to what works. The support networks that you have around you are certainly the most useful resource that any trainee has, in my experience, and whether that be family and friends or colleagues or mentors that can talk through particular challenges that COVID might have presented this year. They're probably the first ports of call, and really the advice I'd give is to invest in those support networks and make sure that you stay in touch with people that you might have otherwise be tempted to, drift away from whilst you're studying really hard. Now, that might have been work that needed to have been put in a little bit further in advance than this time out from the exam. So really between now and the exam, it's about you're talking through, you know, stresses and feelings that you've got with your mentors, whether that's your supervisor or other surgeons that are involved. Personally, I've always found that just chilling out at the end of each day always helps. There's not really much that you can do that's useful for the first 10 minutes after you finish work, and so just relaxing and seeing, you know, putting down your phone and stop answering emails and texts and phone calls for a few minutes each day is the other kind of useful practical thing each day. And I've certainly found that useful during some of the more stressful COVID adaptation sessions that we've had at the health service that I'm at. And finally, if you are really in a place where you feel like you're in trouble, then the kind of professional supports that are available to you as a trainee of the college, whether that's via Converge or whether that's via your GP or other things, are useful too. I mean, Chris mentioned the possibility that if you really feel like your preparation's been so derailed that you need to pull out, that's an option that's available to you. Certainly between the written exam and the clinical exam, it's a significant decision to make, and we don't expect that trainees would make that lightly, but there's certainly lots of different options available for you in that respect too, and your supervisor and your mentors again would be good people to talk with if that helps. And there might be 100 other different ways that other trainees would say work for them to manage that kind of stress as well.
Yeah. Oh, thank you, James. I mean, I appreciate that you're sharing that from your personal experience, but I do think that it's important that candidates understand what is available and what are healthy ways of managing their stresses. I do have a question here that's come through online. This one seems to be addressed to you, Julie. Will the New Zealand exam have different questions to the Australian exam, given it is 1 week earlier?
Yeah, so the situation of the orthopaedic and general surgery exam 1 week earlier in New Zealand is actually business as usual. So that's the usual situation. It's not a specific COVID modification. And so the general surgery and orthopaedic examiners every year write 2 separate exams, which are blueprinted to the same written paper. So that's they will be different exams to the one that's being held in Australia a week later, and that is business as usual. That is the same as every year.
Yeah. Okay. So and that of course only applies to that particular setting, because the rest of the exams, even though they are in different areas of Australia, are held concurrently, so that's not going to be an issue. Yeah, thank you, Julie. We might move on to look forward into 2021, but again, it's just focusing on the fellowship exams, and there was certainly a question that came through about whether exams are still going to be scheduled in 2021, and also when, and what format. Will they have sufficient capacity to accommodate for the backlog, the perceived backlog from this year? Chris, I wondered whether you could give us some idea about what may be happening next year with the exams.
I don't wish to speak for all of my colleagues, but there's a general tendency for minimal change. I mean, we would see ourselves as trying to stick to the formula as best we could. So the dates of the fellowship would be the ones that we would normally pick, which would be May, just after the ASC, and then again in September. So the second exam next year might be a little earlier than the one this year, but back to the usual scheduling. I think, as mentioned before on other webinars, we'll have some learnings from the conduct of this fellowship exam. If we're still in a COVID risky situation and that there is some degree of social distancing necessary, then I expect that the early fellowship in May next year might follow a similar format to the one that we're doing at the end of this year. In fact, we won't get back to full normal exams until social distancing disappears and travel is between all centres.
Yeah, so what I'm hearing is that the scheduling for next year will be very, very similar. There'll be a May exam and maybe a slightly earlier September, October sitting. And the format will be at least in May, highly likely to be similar to what we're rolling out now, obviously depending on the situation.
Adrian, I think it's the borders as much as the social distancing that will dictate how it will be. It's a very big challenge for many of the specialties to run so many sites, and so in May, if we don't have closed borders, we may run more sites than just the single site. But I think we'd be hopeful that we're not running. I think we're running something like 44 different venues, you know, which really is a very major logistic as well as physical task for college staff. So unless COVID is still got closed borders in May, I think you might see something in between what we're doing for this exam and getting back towards just one single venue. I suspect it'll be somewhere in between.
Sure. And can we assume that all the specialties who would normally conduct exams will be conducting exams next year?
Yep, don't see any reason why not.
Yep. Okay. Kerin Fielding, I've kept you quiet for a little while, but I might throw to you now. What happens if trainees and also specialist IMGs have completed all parts of their training or their oversight, but are yet to pass the exam, either because they haven't been able to sit this year, or that they haven't passed this year because they've had one attempt and they weren't successful in that attempt. But their time is coming to an end in either the clinical training or if they're an SIMG on their oversight. So what's going to happen to those people?
Thanks, Adrian. So if SIMGs or trainees have got to the end of their training, they've completed all the requirements of their training time, but they haven't finished their exam, then they are still required to sit the fellowship exam and pass the fellowship exam, but they will not have to do extra time.
Yeah, but will they have their maximum time? For example, an SIMG has 4 years to complete everything,
right.
And trainees have up to 10 years to complete everything. What happens if they can't complete their exam in that time?
They will be, on a case-by-case basis, they'll be given an extension once the case is looked at. So they just need to contact the college, and we will look at each case individually, and then you know, we will be giving them extensions because of the lack of an exam earlier in the year.
Yep. And you did mention that if it's a requirement, is there any prospect that for an SIMG that the exam may be, they may be exempt from sitting the exam, even though it was an initial recommendation?
No, so if it was an initial recommendation in their review when they first got onto the pathway, it will be a requirement. They will need to sit the fellowship exam.
Yep. So it remains a mandatory requirement.
Correct.
Okay. Okay. Look, I haven't seen any other questions coming through online relating to the exam, although you can still ask those questions, but we might move on to the second main theme, which is really around training and assessment. And I'll stay with you, Kerin. So how will training boards manage training requirements given the disruption to normal training opportunities? Logbooks is probably one obvious one, but also attending clinics and the learning that goes with clinics, being on call, managing their patients on ward rounds, etc. A lot of that has been disrupted for a period of time, nonetheless. But how are training boards going to manage that?
So again, on a case-by-case basis, if you have had a significant disruption to your training, a reduction in your logbooks, etc., then you have to contact your specialty training board for special consideration, and extension can be made available to you. Certainly this year has still been valuable, and You know, we know that lots of trainees and SIMGs have been able to complete some of the non-technical competencies. So we're hopeful that most people will not need extensions in time. But definitely, if you have been disadvantaged, if you're concerned, if your logbook's not up to scratch, if you have had a concern, please get in touch with your specialty training board, and each case will be looked at individually.
Yeah, and I think the training boards have made it very clear that they are not just focusing on operative logbooks or even on their technical skills and medical knowledge. They are really looking at all competencies, including collaboration, scholar, teacher, etc. And I have to say my experience, my anecdotal experience has been that trainees have had to call on those competencies a lot more to negotiate themselves around the impediments placed by COVID. And I think that is all observable behaviours that the supervisors have been directed to really take note of and to assess and give feedback. Yeah. James, who should trainees approach if they feel they have received an unfair in-training assessment? And not necessarily because of underperformance, but if a trainee actually feels that they've had reduced training opportunities and they just haven't had those opportunities to demonstrate satisfactory performance.
Yeah, we know that this is an unusual year, and these circumstances might come up for trainees, and it might be expected and it might be unexpected. Usually we would encourage you to first of all reflect on what's been described, and really whether you can see where that kind of feedback is coming from. And if you think that on reflection remains an unfair assessment of how the term has gone for you, then initially speaking again with your supervisor and raising the concern is certainly the important first step. Beyond that, then it's important to raise these concerns with then your specialty training board or committee, or the regional subset of some of the larger ones. And the RACSTA representatives for each of the specialties are also able to provide you with some general advice about particular circumstances that might have come up. They might not be able to help in a formal way, but sometimes the advice of another trainee, if you feel that you can trust another trainee to go through that journey with you, may be useful too. Finally, there'll be, as mentioned before, there'll be other surgeons other than your trainers and supervisors, so other surgical mentors that might be able to give you some advice as to how to manage feedback in this way, and how to react and how to process some of that feedback too. Really at the end, the college does have a new reconsideration, review and appeals process that can be walked through if it gets to that as well.
Thank you, James. And I am aware, because I did actually ask each of the training boards across Australia and New Zealand about the recent changeover, and they've reported there have been minimal numbers of trainees who have struggled to meet all their requirements. Certainly allowances have been made in regard to meeting logbook requirements, but in terms of the lack of opportunity, of training opportunity, whilst the training boards recognise there has been a difference in the training opportunity, they have not had any significant reports anyway of unfairness in terms of the opportunity to demonstrate performance. So, but it's something that keeps coming up, and I think trainees just need to reflect, as you say, but there are different ways of different avenues to address that. So thank you for that. Kerin, I feel like we've sort of answered this question, but what happens if trainees are unable to access mandatory courses? So this is not the fellowship, but other courses such as TIPS, EMST, CRISP, etc.
So the mandatory, the courses started a couple of weeks ago, so that's the good news. And certainly people who need to access those to progress on training will be given priority. Mandatory courses are mandatory, but certainly on a case-by-case basis, every specialty training, you should get in touch with your specialty training board if you have been unable to access a course that you need to access for completion. We will certainly not penalise anybody who hasn't done a course, and you know, in the extreme situation, some extensions may be required for training time to get you through everything. But everybody will be looked at fairly and given the best opportunity to complete.
Yeah. Yeah, so and I think that message is now coming through, and the training boards are well aware of that, and they are making those allowances to grant extension, and
Yeah.
and the college who actually oversee many of these courses are well aware to give priority to those who need it from a timely point of view.
That's fine.
Kerin, I'll stay with you because I have a question here from online. And I think this really applies to the ability to meet logbook requirements. Will this be applied to SIMGs as well, not just trainees, if their logbook is otherwise thought to be unsatisfactory?
It's not quite the same with most SIMGs who are in supervised situations. They don't have the same caseload numbers, except for some groups, for example, gastroscopies, etc. So it shouldn't affect very many of them, but certainly if you were well below your numbers that you needed to complete, then on a case-by-case basis, the individual could be given an extension for time, but it would be a small number.
Yeah. And again, the principle is that where board feels that they can progress someone, either a trainee or an SIMG, in their clinical work, they will allow that progression to occur with the expectation that over a period of time there will be sufficient opportunities to demonstrate competence.
Correct.
Right. And Julie, we've just mentioned about courses and skills courses. Is the college looking to convert some of the face-to-face courses to virtual courses or online versions of courses?
Not at the moment. So certainly tips won't be delivered online. However, there are online courses which can be utilised for similar needs. So for the point of view of trying to develop some improvement in communication skills leading up to the clinical exam, you know, there is a human factors course which is available to all fellows, SIMGs, trainees, JDocs. So a course, an online module like that would certainly help with improvement with communication. But as everything opens up, we would expect the courses, the face-to-face courses, to gain some momentum as well. As Kerin said, they started up a few weeks ago, and we would expect to, heading into next year, to be running more and more courses. The college does have some courses online, but they're not all going to be transferred from being face-to-face to online courses.
Yeah. Yes, and I can certainly echo your words around the human factors. The human factors modules, in fact, there are a number of modules developed online, came out of the TIPS course, and these really supplement the learning that happens in TIPS courses. And I guess it's probably worthwhile mentioning that the reason why the college is unable to convert many of these courses from a face-to-face to an online version is that these courses are very specifically aimed at the trainees and SIMGs developing behavioural skills, and it's very hard to teach and practice and feedback on behavioural skills as an online activity. Certainly the most effective way would be face-to-face. So where some of these courses have elements that can be delivered online, that has already occurred to a large extent. And so what's left over are really the ones that need to be learnt as a face-to-face activity. So as soon as COVID allows us, we will try to restore these courses. Now, there are a couple more questions that have come through relating to the fellowship exam, or at least one more. This one is addressed to you, Julie. Are we sure that there would be only written scenarios in cardiothoracic surgery for the short and long cases? I'm not familiar with the format of their short and long cases, but it sounds like the question is, will this year's running be only written scenarios?
Yeah, as is outlined in the notes to the candidates, and I believe the senior examiner and past examiners, I think there were some practice vivas on the weekend where all of this was also reiterated by the senior examiner. So cardiothoracic are not using any patients for their exam.
Yeah, so it's still a viva, but around a scenario that is read out. Yep.
Yes.
Okay. Thank you.
And the candidates have also the opportunity to practice that.
Yeah. Okay. I don't have any other questions that have come through online, which is fine. But obviously, if anyone who's listening does have a question, this is certainly an opportunity to ask those questions. I just thought I'd go around the panel because I've come to the end of the submitted questions, but just to find out if you wish to add anything further to what we've discussed tonight, really around the fellowship exam. We've covered a few themes in that. We've talked about the format. We've talked about seeking the exemptions for travel. We've talked about also how we might minimise the impact of stress on our exam performance. And then we talked about the in-training assessments and progression through both SET training and also SIMG oversight. So I might start off with Chris. Do you have anything else to add to the discussion tonight?
Oh, no, just to congratulate the candidates on their bravery to progress their careers in the middle of the pandemic. And look, I think you find the examiners are keen to provide you with the best, most valid exam that they can as well. It's not going to be exactly the same as previous fellowship exams. There's going to be a bit more technology. But I think everyone involved in this has got a very good positive feel about it. That there's a wonderful community spirit. We want to get as many people over the line as we can. And once again, just to congratulate you all on your progress thus far.
Thank you, Chris. I might move to James Churchill. Do you have any comments to make?
I think it's important that we're all acknowledging the very large amount of work that's going on behind the scenes for making all of this happen. And I think there's a very large number of staff within the exams department and amongst the groups that convene fairly frequently these days that make, as Julie mentioned, 44 simultaneous sites for an exam function. It's very easy, I think, particularly for a comparison with other organisations that have, that seem to be changing the way that they do their exams and saying that why can't we just do the same? But it's the combination of different ways that 9 different specialties deliver their exams and the kinds of logistics that are involved with running at usual business 9 simultaneous exams and at now unusual business such a rapidly expanded number. So just to acknowledge the efforts of the staff as well, and to say, look, we can't promise that we get everything right 100% of the time, but certainly there is a genuine effort to get as much of it right as much of the time as we can, and the efforts are appreciated.
Thank you, James. Always valuable hearing a trainee's perspective. Julie, Mundy, do you have anything else to add to the comments from tonight?
Look, the only other thing that I did want to mention, and it is in the update, but for those candidates, and it goes for the examiners as well, that need to cross a state border for the exam, please make sure that you go in and look at the requirements for getting out of and back into that state, because most of them require application for a permit. And if you just put in the permit the day before, I think you might add additional stress to yourself in trying to get permission to get back in. So I know that I have to move interstate, and so I'm fully aware that I have to apply for a permit for that state to go into there. So please allow yourself at least a week, but preferably 2 weeks in applying for those permits. You will be receiving, or will have already received, a letter from the college. It's a pre-formatted letter, and you just need to insert your name and the capital city where the venue is for your exam, so that you can then download, print it out, whatever, that letter to go with your application for permit. So please don't leave it until the last minute and then sort of expect us to try and do some sort of miracle, because in some of these states the permit applications are processed by the police, and they really don't care about the fact that you might be going to sit a surgical exam. So please take note of what the restrictions are for the state that you are in or going to, if you have to cross state borders to do your exam. So that's my only bit of advice.
Thank you, Julie. And I guess for any candidate who feels that they haven't got that information, they really ought to contact the college to ensure that they have that information. Kerin, would you like to add anything else to the discussion tonight?
Yeah, just particularly to those specialist international medical graduates out there, if any of you feel that you have been disadvantaged during the COVID period, particularly to access any exam training, because that has been a bit of an issue for some of you in more regional sites, that you have been unable to travel to access some exam training, and you feel that you're not prepared to sit the exam at the moment, and you're doing it because you're becoming time expired, then please get in touch with us, and we can, on a case-by-case basis, organise an extension for you.
Yeah, thank you. All right. I guess the only thing I wanted to add is to echo all of your words, and also congratulate the trainees and the SIMGs for showing a lot of patience with the college, but also a lot of understanding. And whilst I understand that there's also frustrations in all of this, I think we're all working for a common goal, and that is to produce surgeons of a adequate and high enough standard to serve our communities wherever we are working across Australia and New Zealand. And I think that that we shouldn't really lose sight of that fact, that we're here to serve the community, and by acting in the best interest of our patients, we will generally be acting in the best interest of our trainees and SIMGs. I have no other questions that have come through, and I don't really want to pad out this any longer than we need to. I will remind all the listeners that this webinar has been recorded, and it will be placed up on the college COVID hub site. And if you want to view this again, obviously you can. If you have colleagues or peers who you feel might benefit from watching this webinar, please refer them to this. It should be up within 48 hours. So thank you to Chris and to Julie and Kerin and James, and also thanks to Grace Chan and Julian Archer in the background. I wish all of you safe and well time, and also well wishes in your exam preparation to all of you. And I'm hoping that as the year draws to a close, that you all have some positive news to look forward to and some bright futures ahead of you. So thank you very much, all of you, and have a good evening.
All the best.
Thanks. Good luck.
Thank you.